Thank you so much for joining me today. We're going to talk about filling your cup first and preventing burnout. My name is Michelle Dalton. I am a faculty member in the Department of Family and Community Medicine at St. Louis University. Just for some quick information about the disclosure, this project is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services under the Geriatrics Workforce Enhancement Program. Some of the objectives for today are that learners will be able to describe the symptoms of burnout and compassion fatigue. Learners will be able to identify self-assessment measures that will help you assess your level of burnout. And learners will be able to identify strategies for preventing burnout and compassion fatigue. For the agenda today, we're going to talk about burnout, compassion fatigue, moral injury, assessment, and some strategies. Burnout is described as a state of emotional, physical, and mental exhaustion that is really caused by prolonged stress or overwork. And this typically happens in jobs where there's a lot of stress, such as healthcare, therapy fields. We also see this a lot with the police force as well. Components of burnout include physical exhaustion, mental exhaustion, fatigue, detachment, self-doubt, and cynicism. Cynicism can happen very often in fields such as healthcare, where the individual might start to feel cynical towards the healthcare system itself, or they may also start to demonstrate lack of empathy or feeling like they no longer have faith in humanity. Some quick facts about burnout. We do see higher rates of burnout in healthcare fields. This is true of therapists and general healthcare fields. The rate in mental health settings, so whether this is an inpatient, community mental health, or private practice, tends to be pretty high, usually around 50% or so. And in this other study, what they looked at was burnout levels amongst different healthcare providers. So this was looking at senior attending, medical residents, nurses, and other administrative workers. What they found is that medical residents actually had higher levels of burnout, likely because senior faculty here in these positions actually have more coping skills, or perhaps because this is not their first time being exposed to some of these cases. There are a lot of factors that impact burnout. One is the work setting. So working in a setting where you have a lot less support from administration has been associated with higher levels of burnout, as has workload. So feeling like you have too much on your plate. This could be that you have too many patients, too many client hours are really popping up. And then time pressure. So feeling like you don't have enough time to complete paperwork, to be able to see your patients, all of that contributes to burnout. And being overly involved with a certain case. So this may mean that you're spending a lot more energy on that case. You might be spending more hours prepping for the case or finding resources for that particular case. That is associated with higher levels of burnout. And younger age, going back to that idea that we're still learning our coping skills at a younger age, and you might not feel as equipped to deal with burnout. And then just having less experience. There is a major impact of burnout. One is just having a lot less empathy and feeling like you can't be as emotionally supportive just due to having a reduced emotional capacity. So people in burnout are going to feel a lot of exhaustion, and that exhaustion does also extend to their emotional system. And also being a lot less productive. People who are on burnout are not going to be able to produce the same level of workload that they could prior to ending up in burnout. People who are in burnout also experience more instances of absenteeism, so they're more likely to be missing work, to leave work early, or to show up late, and also more likely to have mental health challenges, notably anxiety and depression. Burnout can be distinguished from compassion fatigue. Compassion fatigue involves taking on the suffering of your clients or patients that then makes it challenging to experience empathy or compassion for them. Compassion fatigue can happen when you've been exposed to vicarious trauma. So this can be that you were exposed to something in the workplace. This could be like a patient death, witnessing a very traumatic car accident. Any of those things can contribute to vicarious trauma, which then results in feelings such as avoidance. So avoiding triggers of that trauma. This could be avoiding other patients that remind you of the patient that you lost. Numbing, so this could be emotional numbing. It also could be numbing with substances. Oftentimes when people experience trauma, they might numb out with certain substances, alcohol being a very common coping skill. And then hypervigilance, so being scared that this is going to happen again and taking a lot of measures to try to prevent that, oftentimes when those measures are not needed. Some symptoms of compassion fatigue include emotional exhaustion, feeling a sense of helplessness, and also reduced empathy. Moral injury has been distinguished in the literature from burnout. It is very similar, and some people argue that they are kind of two sides of the same coin. But moral injury is defined as a failure to prevent something from happening that goes against deeply held moral beliefs, such as putting the needs of the patient first over, say, the needs of an insurance company, over the needs of the healthcare system that the individual is working in. So moral injury happens then when you are not able to provide the best care to patients due to these factors that are well beyond the provider's control. And oftentimes it does require a balance between the hospital, the individual provider, healthcare system, insurance, etc. So for example, it may be that the insurance company is denying a life-saving treatment and the provider then has to be in accordance with that unless the patient is able to provide it out of pocket. And oftentimes these moral injuries are described as occurring due to exceptional circumstances or very traumatic events that happen in healthcare. And it results from witnessing human suffering and having to deal with morality of actions of the provider that might also violate their moral compass. So they essentially have this value system, which is oftentimes that the patient's needs should come above everything else, that we should do everything we can to protect the patient. But that may not always be possible given whatever situation has popped up. Again, because it could be insurance denial, or it may be that that treatment isn't even available at that setting. Now that you know a little bit about burnout, moral injury, and compassion fatigue, it's important to be able to assess where you're at with it. This measure here is called the Pro Quality of Life Health Measure. It is a free measure that assesses things like compassion, satisfaction, perceived support, level of burnout, secondary traumatic stress, which does make you at increased likelihood of experiencing burnout and compassion fatigue. And it also measures moral distress. This measure will be provided at the end. Now, there are some risk factors of burnout that are really important. Another measure that I've included here is a measure of moral distress for healthcare professionals. This measure came out in 2019, and it really walks you through a lot of items that can help you assess the situation more accurately. So, for example, being required to care for patients when you don't feel qualified to care for them, participating in care that causes unnecessary suffering or does not adequately relieve pain or symptoms, watching a patient care suffer because of a lack of provider continuity. The other thing that I want to talk about is the self-care assessment. There is a self-care behavior inventory, and there's also the NAMI self-care inventory. This self-care assessment is one that I both use with supervisees or trainees and also use with clients, so you can use this patient-facing as well. So in this self-care assessment, it covers several different areas. It'll cover psychological or emotional. It'll cover physical self-care. It'll also cover spiritual self-care. And it has the individual rank how well they think they're doing on a scale of 1 to 3, with 3 meaning that you're doing it as well as you could be. And then it also gives you an opportunity to indicate which area you would like to improve upon. So here you would just put in a star, and that would indicate that it was an area that you wanted to work on. In order to prevent burnout, you also need to understand where you're at. So having those self-care assessments can help you figure out if you're at high risk for burnout. Once you've identified if you're at risk for burnout, you really want to identify some strategies that can help reduce burnout. One of those being able to process these emotions with a peer or a supervisor. If you don't have the ability to do that, you also can seek individual therapy. Having peer support from colleagues that is not tied to just emotional support. So again, this could be engaging in peer-based activities that could be scheduled at work. This also could be outside of work, but regardless of what you're choosing, that it feels like you're engaging meaningfully. And also finding meaning making in your role. So being able to tie in what you're doing to a greater purpose. And in terms of self-care, being able to examine your beliefs about self-care, really deconstructing like, where did I learn how to care for myself? In family therapy, we talk about your self-care genogram. So identifying how your mom or your dad or other caregivers taught you about self-care can be important to understanding how you're currently caring for yourself and also identifying barriers. And then just making sure that you're engaging mindfully with whatever activities you are using for your self-care. Self-care includes behaviors that enhance emotional, physical, spiritual, and cognitive domains of functioning. It's important to recognize that self-care is a process. It's really not a one and done. You're not going to be like, hey, I took a bath now, I'm feeling completely relaxed and I don't need to do anything else to prevent burnout. It is really important that you're doing this and building it into your routine. So this might mean that you're taking a walk every single day, maybe after work, or eating a balanced diet. Maybe you're listening to music after work to help yourself decompress, or you're engaging in other mindfulness activities such as yoga. Another part of self-care and preventing burnout is engaging in good sleep hygiene. So this includes not only maintaining a regular sleep schedule, which includes trying to get out of bed and go to bed at the same time within about 20 minutes or so. So really saying, hey, by 8 p.m., I'm going to start winding down with the hope of being ready to fall asleep around 10 p.m. and kind of holding yourself to that. It can be really helpful to do activities that kind of bring down the physiology before bed. So you can use relaxation techniques. I really like to have clients do like a body scan where they start at the bottom of their feet, kind of really checking in and then walking themselves all the way up to the top of their head. That can be a good way of kind of getting the brain to decompress. Also, just doing some general deep breathing can also really help. Taking a warm shower or hot bath 90 minutes or so before bed can also help. And trying to avoid electronics, or at least at a minimum, turning off the blue light filter, because that will make it a little bit easier to fall asleep. And then also making sure that your bedroom is appropriately set up. That could mean that it's cool, it's dark, and the bed space is very comfortable for you. Now that we've talked about how to prevent burnout, it's also important to talk about how to cope with moral injury. Some strategies for reducing moral injury includes partnering with administration to really help them understand what's going on with patients. Sometimes the disconnect is because administration and providers are not having appropriate conversations, so they may not know what kind of patient care is needed on the front lines because they're not there on the front lines. And on the flip side of that, it is also really important that providers understand what administrators are dealing with on a day-to-day basis that are influencing some of these decisions that are being made. It's also important to be considering building a network or a community of other clinicians, having people that you can go to decompress with, having people that you can talk through these moral or ethical dilemmas with. And also it's important to have mentorship. So identifying a more senior person at your field site that can help you. Also having more support at work and also engaging in activism can help. So really advocating for better treatment, better coverage, etc. Having debriefing sessions, as we mentioned, and then also there's something referred to as moral distress consultation services. This is kind of a specific kind of support that can be offered by certain healthcare settings, where there's kind of an ethics committee that you can go to discuss these cases and receive consultation services. I have placed some resources here on this slide, one that will provide you the quality of life assessment measure. It is a free measure, so I highly encourage you to check it out. There's also the NAMI self-care inventory that's included here, as well as the self-care assessment that we walked through that had the 1, 2, 3 and STAR. There's also some information here on managing moral distress. I've included some references on the next 2 slides. If you have any questions, please contact the SLU Family Center for Healthy Aging. The email address is listed here as well as the phone number, and this link will take you to the website. If you have any questions for me directly, you can email me at michelle.dalton@health.slu.edu. We do have some upcoming events. One is the Interprofessional Perspectives in Geriatric Care. This is a 3-credit 6-day course, and for more information, you can email Allison Gibson. We We do have the first annual Healthy Aging Conference, which is from June 6th to June 7th, and that includes cognitive stimulation training. Then there's the third annual SLU Summit on Loneliness and Social Isolation, which is on October 10th from 9 a.m. to 4:15. I also strongly encourage you to complete the evaluation. You can use the QR code here, or you can use the link below. Thank you so much for your time.